I see that Dr. Tina van Haver has joined us, so perhaps we can switch the order in the opening statements, if that's okay. So if I can welcome to the webinar Dr. Tina van Haver, who is representing the Cabinet of the Federal Minister of Public Health. So Tina, I welcome you to take the floor now.
Yes, thank you, Mafalda, and good morning, everyone. I'm happy to see so many familiar faces. It's only in the digital way, but we're also happy to participate. First of all, I want to congratulate the research team on behalf of the Minister of Health, Frank van den Broeke. As I read in your report, you had a hard time reaching this hidden population. This group of young people using prescription drugs non-medically is not present in treatment services, nor known in law enforcement. They are hard to reach. And that's already the start of an important societal pattern that it is being concluded in this report. Belgium has a pill-popping culture, as it is written in the report. From our kindergarten on, we learn to take a pill when we don't feel well. Some medicines even give you the option to choose the flavor, whether it's mint, banana, or strawberry. Of course, I have small children too, and when they are really sick, I want them to take the medicine without you having to pick a battle every time they have to take this pill. But still, we have to be very cautious about it, on what we learn our children from the ages of 3 years old. Not only for physical problems, but also for mental problems, we ask our doctors to prescribe something that can help us as quickly as possible. So in our opinion, one of our most important tasks is to change this perception, to change these practices. But changing something as fundamental as that will take some time and a lot of initiatives. So our administration is already implementing several actions as we speak to change this attitude, to promote alternatives. And I really want to thank them too, the team of Kurt Doms and his colleagues. But we cannot do this alone. Prevention, as well as the organization of mental health, is the competence of the federated entities. On a federal level, we have important administrations like the Federal Agency for Medicines, the INAMI, etc. Since earlier this year, we relaunched the ACD, the General Drug Policy Organ, the consultative body that brings together all involved cabinets on the different policy levels. And I must say, we are very ambitious. We will put the policy recommendations of this study on the agenda of this meeting. It is clear from the report, for example, that prevention efforts should be increased. We already know from other reports, like the SOCOS study and data on drugs, that all costs that prevention is underfinanced. Let's look with the federated entities how we can provide more prevention at, for example, schools on the use of medicines. And as we learned yesterday, there should be less attention on illegal drugs. So according to the experts, so we might have more time on medicines. There is already an offer to implement in different school settings. It is a matter of bringing the attention to it and facilitating the implementation in the different school settings. In a broader way, we are working together with the federated entities as we speak on increasing the mental health services to make them more accessible. In this way, we can hopefully change the pattern of taking a pill when actually psychological assistance is needed. This goes together with changing the prescribing behavior of doctors and other healthcare providers. This could be introduced, as it is more and more in recent curricula, in the education of these healthcare providers, but also in continuing formation. This should not only be about changing the prescribing behavior of medicine, but also on the more broader mental health issues. What alternatives, for example, are there when people are experiencing sleeping problems? As a doctor, what can I prescribe? What can I tell them? We have different initiatives we are implementing on the federal level. Our focus is on opioids, for example. We are implementing an action plan on opioids. but also on sleeping pills and sedatives. How can we promote the rational use of prescribing these drugs? How can we improve knowledge sharing between healthcare providers and the patients? We are implementing the electronic patient file, the project FIDES, etc. We are also looking at adapting the legislation so patients receive only their current amount of medicines they need, limiting the amount, but also limiting the time in prescribing opioids. But we also have to make sure that medicines stay accessible for all groups. Some vulnerable groups seem to have difficulties to access all medicines. We should not only focus on healthcare workers, on the system, on the pharmacists, etc., but also on the students themselves, educating them, empowering them by communicating to them through the pharmacists, doctors, but also by simplifying the prescriptions and by changing the status on medicines. Medicines can also be very abusive, like illegal drugs. By increasing awareness among the general public about possible alternatives for the use of psychoactive medicines. And since this study is unique, it's the only one I remember, this also means we have to continue the research on this topic, but also on broader consequences on the non-prescribed use of medicines. We need data to build our policy on, especially on more vulnerable groups. And we will keep looking for good practice internationally. And this is also the strength of the drugs program within BELSPO. So I would like the research team to thank you very much for your report, for your policy recommendations. I hope I made it clear that this is an important input for our policy. Especially our minister, I must say, considers scientific research important as the basis for his policy. Thank you, and I wish you an interesting webinar. I give you the floor, Mafalda.
Yes, thank you very much. And thank you for raising already several important points. I think that really set the tone for what I hope will be our subsequent conversations and discussions here today. So thank you for that. I think Aziz hasn't joined us yet, so we'll just move on to the next item in the program. So we'll now move to the presentation of the results of our study in Belgium concerning the non-medical use of prescription drugs among young adults. And it is my pleasure to hand it over to my colleagues, Dr. Frédéric Bauet and Dr. Julie Tiebergien. So the floor is yours.
Yeah, good morning, everyone. I hope everyone can hear me. So now we will present the findings of our study into the non-medical use of prescription drugs among young adults in Belgium. And I will do this together with Julie Tiebergien from VIVES University College, who is also one of the promoters of this study. So as an introduction, I want to give the study's background. So in recent years, there has been an increase in the use of psychoactive medicines. And at the same time, there are increasing concerns about the non-medical use of prescription drugs. And then particularly regarding sedatives, analgesics, and stimulants. Also, previous research shows that there are higher rates of the non-medical use of prescription drugs among young adults compared to other age groups. And this population might be at higher risks of adverse health outcomes. Now, so far, limited attention has been paid to this phenomenon in research in Europe and including in Belgium. Studies have been conducted, but they focus on particular populations such as students. Also, most studies focus on the use of stimulants among students in higher education for performance enhancement, so in academic contexts. So the aim of this study was to better understand this phenomenon of the non-medical use of prescription drugs among young adults in Belgium, and to better understand their perceptions about their use, and associated harms. So we look into the non-medical use of psychoactive prescription drugs, but what does non-medical use mean? It means using prescription drugs without a prescription or using it differently than prescribed, meaning using a higher doses or using it more frequently or using it with other administration methods or using it for other purposes, for instance, using it for recreational purposes. Now, in our study, we focused on 3 types of psychoactive medicines, including stimulants, for instance, Ritalin, which is usually prescribed for the treatment of ADHD, then analgesics, so the stronger painkillers such as codeine, and sedatives. A well-known example are benzodiazepines, so usually prescribed to help people sleep or to reduce anxiety, and so on. So these are the study's research questions. So first of all, what do young people think about their use practices, about the supply, perceptions of risks, and social acceptability? What information do they consult and rely on? How has the non-medical use and supply of prescription drugs been discussed among online communities? And what measures may help to prevent or reduce non-medical use and related harms. Now, this last and final research question will be discussed, or the results will be discussed after the break when we will present our policy recommendations. So, to answer our research question, our study had a mixed methods research design. So we conducted an online survey and in-depth interviews among young adults who have used prescription drugs non-medically. And we also conducted a rapid analysis of online discussion forums in which the non-medical use of prescription drugs has been discussed. Now, how did we recruit those young adults? So we used a targeted sampling strategy. So we only targeted those young adults who have used prescription drugs non-medically. So it's not a randomized sample, and we relied mainly on online recruitment strategies. Also, how did we recruit people who participated in in-depth interviews? So these were recruited via the online survey. So people who participated in the online survey were asked if they were willing to participate in the in-depth interview. Now let's have a look at the results. So very quickly, to give you an overview of the characteristics of the sample. So as I said, there was a study conducted in Belgium, but as you can see, more Dutch-speaking people participated than French-speaking. The majority was female in our survey, while this was the other way around in the interviews. The average age in our sample was 23 years old, and most of our respondents were students, and most of them were in higher education, at university. So it was a highly educated sample, and this might be the result of our recruitment strategies. So young people our study shows that young people who use prescription drugs non-medically are a heterogeneous population because of having different use patterns, having different modes of use, having different user profiles, also depending on the type of medicine used. And as I said, in our study, we look in 3 types of medicines, and the survey results show that for each type of medicine, slightly more than half of the participants reporting using it non-medically. So now, when do they use prescription drugs for the first time non-medically? So the average age of initiation is between 16 and 18 years old, also depending on the type of medicine used. We see that they start using with or without a prescription, and they get their prescription drugs mainly from family members in the case of analgesics and sedatives, and from friends in the case of stimulants. Now, for which reasons are those prescription drugs used non-medically? So we categorized motives for use into 3 categories. And first of all, the first category is performance enhancement, for instance, using prescription drugs to study. The second group is self-medication, so for therapeutic reasons. And then we also have recreational use. Now, our study results show that prescription drugs were mainly used among young adults, were mainly used for performance enhancement and self-medication, and less often for recreational purposes. And when prescription drugs were used for performance enhancement, it were mainly stimulants and mainly for study performance. This might be the result because we had many students among our sample. Then if prescription drugs were used for self-medication, it were mainly sedatives and analgesics, and sedatives were mainly used for psychological problems. So they were used to help with sleep or to reduce sadness or anxiety or stress and so on. Then, of course, analgesics were most of the time used to reduce physical pain, but we also see, and as you can read in the citation, they were also used for psychological problems. Then, as I said, prescription drugs were less often used for recreational purposes, and when they were used for recreational purposes, it were mainly stimulants. And we see that they were used most of the time to experiment, but also to party or to get high or to socialize or to have a good time with friends and so on. Now, if we look at use patterns, then we see that most or the majority of the young adults were for past 12 months use as well as lifetime use, they reported low frequencies of use. So most of them were occasional or sporadic users. Then with regards to administration methods, most or the vast majority used prescription drugs orally. So actually the recommended administration method or the prescribed administration method. And then the second most reported administration was snorting. And then we see that those alternative administration methods were actually associated with recreational use. In our study, actually, it happened rarely that prescription drugs were injected. Then if we look at dose, then doses varied widely among our participants. So some participants used doses as recommended, as prescribed, while others used lower or higher doses. But what we did see is that when prescription drugs were used for recreational purposes, it were often higher doses. Then there were also participants who reported using prescription drugs at the same time as other psychoactive substances. And sometimes this was on purpose to increase or decrease the psychoactive effects, to alter also the overall experience. And as you can read in the citation, to give an example, for instance, some young adults reported using illicit stimulants during the evening to study or to party, and using sedatives afterwards in order to be able to sleep. Then if we look at supply, so this is in line with using prescription drugs for the first time. So most of them received them from a family member or from a friend, but also some had their own prescription for a medical problem. And when young adults received prescription drugs from family members or from friends, this was most of the time for free, and it were relatively small amounts. So the minority really bought prescription drugs or bought them from the internet or from dealers. And then we also asked our participants if they ever have shared or sold or traded their own prescription drugs, and then almost half of the participants said that they did. Also, the majority said that they been offered prescription drugs outside of a medical context, and these were mainly stimulants. And then we also looked at the young adults' perceptions of risks concerning the non-medical use of prescription drugs and also the acceptability. And then we see that young adults did report health risks associated with the non-medical use of prescription drugs, but this also really depended on the use patterns and type of medicine. To give an example, when prescription drugs were used when more frequently or when high doses, then young adults considered it to involve risks. Also, many times the use of sedatives was considered to be involve more harms than, especially regarding addiction, than the use of stimulants. And young adults also considered the use of prescription drugs to be safe because of this accepted medical and legal status. So because it was prescribed by physicians, it was delivered in pharmacies, it was used medically by many people, and therefore in this context it was also considered to be more safe than illicit drugs. But they also, in this context, they also refer to the production processes, because there is quality control when prescription drugs are produced, which is obviously less the case or not the case with illicit drugs. Also, the young adults prescribed their own use as responsible, also because many of our participants reported low frequencies of use, so for instance, using occasionally, but they also reported other informed choices regarding use patterns, regarding supply sources, also context of use, to reduce possible health risks. So they reported different harm reduction strategies to reduce possible harms. And an important one is, for instance, informing oneself before using, but Julie Tiberghien will talk about this later. And then finally, we also observed that the young adults thought that functional use, so using prescription drugs for health purposes or using it for performance enhancement, was actually considered more morally acceptable than using prescription drugs for recreational purposes or using it for hedonistic purposes. So I'm going to go to the next slide and give it to Julie from here.
Yes, I'll just take it over. Okay, thank you, Frédéric. Warm welcome from my side as well, of course. I will guide you through some other research findings. And before I address the findings regarding information sources, I would like to share one slide about the COVID-19 pandemic. It had a huge impact on our lives, and it still has, unfortunately. And it also had an impact on our research, not only on the methodology, but also we took the opportunity to ask some questions about the impact of COVID-19 on the non-medical use of prescription drugs. An important note here is that we had our data collection period from the end of June until mid-October, which means that if participants were referring to the impact of COVID-19, that they were referring to the first period of the pandemic, which was a strict lockdown. So this is important to take into account when looking at these results, of course. First of all, if we look at the perceived access and availability, we found no particular effect on those issues, but we found some smaller changes in the patterns of use. And in particular, regarding sedatives and stimulants, we found small changes. For instance, stimulants, we found that there was less use reported as a kind of impact of the COVID-19, while sedatives were reported to be used more and in higher amounts during the or as a result of the pandemic. This has everything to do, of course, with the main motives of use that have been discussed by Friederike. For instance, stimulants are mainly used for study performance and recreational use. or recreational purposes. And it makes sense, of course, if late night venues or bars, clubs and so on are closed, that there are less opportunities to use recreationally. So that's a part of the explanation. And if we look at sedatives, there we found different perspectives, depending on the individual cases. For instance, for some people, the lockdown was actually a period where there was no stress, there were no social obligations, no expectations, so they felt kind of relieved during that period. However, when the lockdown ended, they had more stress and they felt less comfortable at that time, and they have started to use more than they did before. But for other participants, it had a kind of negative effect in a way that they started to use more during the lockdown because they felt more stressed and more unbalanced because they could not see friends or family members. So you see there was an impact really in relation to the use of sedatives, but it was different depending on the individual cases. And anyhow, I think this gives us some insights, but it would be very interesting in further research to have a look at the effects of the COVID-19 pandemic in the long term. Now, we only had a look at the short term, of course. So let's move on to the results regarding information sources. As was mentioned by Frédéric, we also had a look at which types of information, which sources of information are consulted by young adults. And generally, it is important to mention that the young adults really stress the importance of being informed, of learning, or their willingness to learn about the medication that they are taking. They even stress that being informed is really an essential factor in managing their own use and their risks of use. So they see being informed as a part of their risk management strategies. And of course, we also had a closer look at the type of information that they are really interested in. And if they look for extra information, they look for information about the chemical structure, the effects, the dose limits, administration methods, and of course, also about risks and harms associated to use. And furthermore, they also stress that they not only look for objective medical knowledge, but that they are, of course, also interested in subjective reports, like trip reports from peers, but also experiences that are shared among peers. So they look for both types of information. And what was also interesting to see is that they are very likely to learn from friends and family members who they trust and who are willing to share their knowledge. And of course, this makes sense as their first encounter with prescription drugs is often through friends and family members. So they often turn to those initial sources of information, but they also stress that they are looking for other sources of information too at the same time. And if we define those other sources, those sources are mostly online sources. This is also quite obvious, I think, because the internet, it is there, it is part of their everyday lives, and it's readily accessible, available to anyone. So if we have a look at how they actually search for information, we see that they often use search engines like Google, and that they end up at professional websites, but also in discussion forums and so on. So online sources are very often consulted. But important here too is that our interviewees really stressed that they know that there is some information wrong or not correct. So they are really critical about this type of information that is on the internet. So they try to critically evaluate information, but also to cross-check the different sources of information that they turn to. On the slide, you also see that in the overview, there is a reference to medical professionals as well. So that source of information is also seen as an important source of information according to our participants. However, they also stress that they often provide more generalized information, and they often use difficult wordings. and that they are not so easy to approach, especially not for questions about the non-medical use of prescription drugs. So this is also, I think, an important finding, but we will come back to this later on in this webinar. So I've mentioned the importance of online sources, and as one of the methods that we have used next to a survey and the interviews, we also had tried to have a closer look at the online forums and what is actually discussed on those online forums. In particular, we did a rapid analysis of those online forums. So how did we proceed? Well, we did some online searches for online forums where the non-medical use of prescription drugs was discussed. And we used two inclusion criteria. And the first one was that we had a look at the fora where the non-medical use was discussed, of course, but also the fora that were open and available to anyone. So we only included those. So we excluded the private groups. For instance, on Facebook, we have several private groups, but we did not include this in this rapid analysis. And also a second important criterion was that we only took into account the forums where the exchanges took place in Dutch or French. This is because of the scope of our project. However, we are fully aware that using this inclusion criterion comes with some limitations. We are not sure who is actually engaging in those forums, of course. Are they Belgium? Are they not Belgium? Or are they part of our target population of young adults or not? So we do not know, but this is an important limitation that we need to take into account when looking at these results here. First of all, we did an inventory, or we made an inventory of the forums that were in Dutch and in French, and we ended up with 27 online forums in our rapid analysis. And in the second phase, we did a thematic analysis of the titles, the topics that were discussed in those forums. And in particular, we did this analysis of 131 topics or titles. And like I said, we ended up with 27 relevant forums. And if we look at our survey data, we see that there is a lot of connection. In our survey, we asked to our participants which forums they consult. And here we see that out of the top 7 that they have mentioned, we had 4 included in our rapid analysis. The 3 other ones are international drug-related forums. So they were excluded based on our criteria, but it would be interesting, of course, to see in further research how the non-medical use of prescription drugs is discussed there. So if we now zoom into the content and the structure and the focus of these 27 online forums, we see that mainly we found discussion forums in our search. Discussion forums can be defined as forums where messages are posted and where people react and they ask questions, they react to each other and so on. And this was the case in 25 of the 27 forums that we found. Only in 2 forums we found that the structure was mainly based on a Q&A structure, which means that one question was posed, an answer was given, and this was moderated by, let's say, a professional or a professional organization. If we look at the focus, we found that most online forums were drug-related, so where the topic or the main focus is really on drug issues. For instance, illicit drug issues, but also illicit drug issues. The other forums that we found had a more general focus, like, for instance, they discussed gaming issues or health or well-being elements. So there was a different focus, and there was then 1 or 2 or 3 questions about non-medical use of prescription drugs. So there was a different focus seen here. If we look at the contents of the forums and in particular of the topics that were discussed, There was, of course, and that is also quite obvious, I think, a focus on giving advice to others and sharing personal experiences. And what was interesting is that we found a close link to the main motives of use that we had identified in this study. For instance, we found examples of discussions about stimulants, sedatives, and analgesics. And if we look at discussions about stimulants, we found a close link with the main motives, which are study performance and recreational purposes. And the same for sedatives. Here we found a large focus on topics, discussions related to self-medication. For instance, like how to handle the risk for addiction, how to handle withdrawal symptoms, and so on. The only atypical thing was about analgesics. Here we found that the main focus was on the recreational use of analgesics, while the main motive that we had discovered in our study was that they use analgesics mainly for self-medicating purposes. So this is also something interesting and maybe a route for further research, I think. And finally, of course, the focus was on the anecdotal evidence in these discussions. Just to say that we found very few links to professional websites, or even scientific literature. So those links were rather scarce. The focus was really on sharing experiences, sharing trip reports, and so on. So if we had to conclude our study, I think it is quite clear that our study confirms the complexity of the non-medical use of prescription drugs, as it is associated with different types of medication, but also different motives of use. And I think it's really clear now, but I think the study also echoes several opportunities for further research. For instance, in case of information sources, but also related to the age of initiation, the sources of initiation, of the initial sources of supply, I mean. So yeah, a lot of opportunities for further research, but I think also that this study echoes a lot of discussion points in relation to prevention and reduction of the non-medical use of prescription drugs and its associated risks and harms. But of course, we will come back to this in the second part of this webinar. So I would like to thank you for your attention. And of course, if you have any question, please ask them in the Q&A at the end of this session. So thank you.
All right, thank you, Julie and Frédéric. We now move away from the Belgian context and we'll hear more about recent developments in the US by Professor Ty Shappis from Texas State University. Professor Shappis couldn't join us live today due to the time difference, but has kindly pre-recorded his presentation, which will now be showing to you. Frédéric, you can go ahead and launch the presentation.
Hi, everybody.
Perfect.
I am Ty Shappis. I am a professor in the Department of Psychology at Texas State University. And before I get into my talk about prescription drug misuse in young adults in the United States, I wanted you to have a face to put with the voice that you will hear during the presentation, and just say a word of thanks to the organizers of today's event for inviting me. It's very exciting to be here with you, even if not live, because it is about 3 a.m. in Texas. But I am very excited to take part in this. I'm very excited to see the data that will come out of this research study, and to when I have access to the taped presentations, to see today's events. I will say this at the end, but please contact me if you have any questions about today's presentation, or you're interested in any kind of collaboration. I'm always very interested in that kind of thing. So with that, I will go ahead and get started. So my topic, my presentation today, will cover prescription drug misuse among young adults living in the United States. And before I get started, I want to define what a young adult is. A young adult, for the purposes of my presentation, is someone 18 to 25 years of age. It's not uncommon to see 18 to 29 years or 18 to 30 years defined as a young adult. Those are actually pretty common definitions as well. We've tended to stick to 18 to 25 years of age, partially because of the data we use, but these are all slightly arbitrary decisions, and I think it's important to make sure that everyone's clear what age group I'm talking about when I use the words young adult. So we're focused on US young adults and prescription drug misuse in this group, not just because of the exciting data collected in Belgium on young adults, but also because this is a very important group to focus on. As many, if not all of you are aware, rates of prescription drug misuse are, if not the highest, they're among the highest in the world in the United States. And I think it's pretty safe to say that they are probably the highest. The best data for this come from opioid medications and opioid misuse. There are also very high rates of opioid misuse in some other English-speaking countries like Canada and Australia, but the best data do suggest that the opioid epidemic really was worst in the United States, and prescription stimulant misuse is most likely at the highest prevalence rates in the United States. Interestingly, I think benzodiazepine misuse is the least studied of these. It is in the United States. Prescription drug misuse in general, I think, is understudied in other countries. So it's a little less clear, though I would conjecture it's probably highest in the United States as well. Some of this is likely to be a function of medication availability, of how pain conditions, attention deficit hyperactivity disorder, anxiety disorders, the conditions that these medications are intended to treat. They are often treated with medications in the United States as opposed to other interventions. So why focus on young adults? Well, within the United States, young adults, as we will see, because I'm going to cover this in a little bit, young adults have the highest rates of stimulant and benzodiazepine misuse. For opioids, though, they're very similar to individuals who are 26 to 34 years of age. There's really not a clear difference between young adults 18 to 25 years of age and those 26 to 34 years of age for opioids. Another major reason to focus on young adults in the United States is that drug overdose rates overall. So a quick caveat that drug overdose does not have to involve a prescription medication. About 1/3, and this number may have declined somewhat recently, of opioid-involved overdoses involve a prescription opioid. But prescription benzodiazepine medication is involved in an increasing number of drug overdoses. Stimulant-involved drug overdoses are increasing, although those are largely, if not almost exclusively, a function of illicit stimulants like cocaine and methamphetamine. But drug overdose is the fourth leading cause of death in US residents 15 to 24 years of age. So it's a key cause of mortality in this age group, and it's a preventable cause of mortality. So our research has been focused primarily on adolescents and young adults. I do have some work in older adults, if any of you are interested in that. That is out there in the literature, but we've been fortunate enough to be funded by the National Institute on Drug Abuse, a constituent arm of the National Institutes of Health here in the United States, to examine young adults and adolescents in terms of their prevalence rates of prescription drug misuse, and then their motives and sources of medication, with a particular focus on education. In short, because a lot of this research is out in the literature, and I want to cover other topics today, we've consistently found that young adults who are in university or who are university graduates have higher rates of prescription stimulant misuse, but lower rates of prescription opioid or benzodiazepine misuse than young adults who dropped out, who left secondary education, or who completed secondary education and perhaps did not go on to university, or who went to university briefly and left university. We have 2 grant applications into the National Institute on Drug Abuse, and we're hoping to examine the first 2 topics in the first grant application, which would look at historical patterns of misuse with a particular focus on different age groups and different cohorts. There's some evidence of cohort differences in prescription drug misuse, and given the evidence I'm going to be showing you on the next slide and the following slides, it may be that we are really seeing declining rates of prescription drug misuse. The evidence suggests that rates have been declining for opioids at least since the middle or late 2000s. We're also interested in longitudinal patterns of prescription misuse, something I'm particularly interested in. Among 18-year-olds who have a history of prescription drug misuse, what specific sources or what specific motives correspond to poorer or better trajectories? In other words, what correspond to developing substance use disorder symptoms? What correspond to cessation of misuse? I'm very interested in that, and hopefully if we can get a grant funded, we will look at those 2 things. The other application would look at a completely different data source of primarily 18-year-olds, but also some older young adults who are entering university. And we have data from well over 1 million, maybe close to 2 million individuals who took part in a commercialized prevention program, but I have access to the data, thankfully, looking at different minority groups and their prescription drug misuse, which is under study. We're interested in racial ethnic minorities, and I'm particularly interested in sexual minority groups and gender minority groups. A lot of these subgroups, asexual individuals, genderqueer, non-binary, other non-binary individuals, they're really not well studied. And there's some interesting tie-ins that we can do to policies in the United States. And we're hoping to do that in another grant. So keep your eye out for those things. Hopefully with funding, we'll be able to do them. But what I'm going to talk about primarily today are recent trends in prescription drug misuse. So this uses data from 2015 to 2019, as you can see. Looking at past year misuse, we'll start with opioids. And as I mentioned, I did want to situate young adults who are the brighter, I should say, red line, with other age groups. And so what you see using data from the United States National Survey on Drug Use and Health is a significant decline in prescription opioid misuse among young adults. If you smooth out the line and linearize it into an annual trend, you see that it drops by 0.78 percentage points each year. Obviously, it's not perfectly smooth, and some of that's probably an artifact of the data collection and sampling, but we do see a significant decline. As I mentioned previously, individuals 26 to 34 years of age are very similar to young adults, and they also have a significant decline. Adolescents, which are much lower down, have a significant decline, but no other groups do, and that 35 to 49 age cohort is a particularly interesting one for that. We also see sex differences in trends in opioid misuse. So again, among young adults overall, there's a decline of about 0.78 percentage points per year. And there's a significant interaction where males started in 2015 at 9.7% prevalence rate for past year opioid misuse. Females started at 7.4%. By 2017, those differences were virtually gone, and you see that males and females in 2019 differ by only 0.4 of a percentage point, 5.5% for males, 5.1% for females. So in males, the darker blue line to highlight it, there's an annual trend decline of slightly over 1 percentage point for past year prevalence of opioid misuse. But for females, it's less than half that. You see a decline of 0.52 percentage points on an annual basis. And again, you see a decline from 2015 to 16 and then a rise to 2017. That's almost certainly an artifact of the data. And smoothing out the line probably shows us a more accurate picture of what has happened. But you see that males have declined much more significantly than females, such that the initial sex difference in 2015 no longer exists. For benzodiazepine misuse, and apologies, I had to move around some aspects of the figure because young adults clearly have the highest rates. They're at the top of the figure. There's no decline in young adults. They were at 5.2% until 2017, where it declines to 3.8% in 2019. And if you linearize this trend, it's a decline of 1/3 of a percentage point, 0.33, each year. It is a significant decline, and it's the only, young adults are the only age group with a significant decline. In contrast to opioids, there are no sex differences in the decline between females and males. And indeed, you actually see females and males sort of trade places a little bit in 3 of the years, 2015, 17, and 18, males have higher prevalence rates. In 2 of the years, 2016 and 2019, females do. The reality is there's probably not a sex difference at all. And some of the smaller decline in females is slightly arbitrary insofar as we picked 2015 to start our decline, our analysis, than 2016. But you do see males decline 0.43 percentage points, females decline 0.23 percentage points. Females are the decline in females, I should say, is just significant. The upper confidence interval is -0.01%. So it's barely a significant decline, but it is a significant decline. For stimulant misuse, I think one very striking thing is that rates are much higher, nearly double in young adults than the nearest age group, which again is that 26 to 34 year cohort. Young adult prevalence rates for 2015, 16, and 17 were roughly 7.5%. For past year stimulant misuse prevalence, declining to 5.8% in 2019. And again, this is a significant linearized trend that's basically 0.4 of a percentage point decline per year. We do not see a significant sex interaction for declines. Males declined by roughly 0.5 percentage point per year. Interestingly, females declined by slightly over 1/4 of a percentage point per year, 0.27. But the decline in females was not significant. The upper confidence interval was slightly above 0, so it's a non-significant decline. Again, some of that is arbitrary in terms of picking 2015 versus 2016 to start. And I should say, in 2015 was the first year of a new prescription drug misuse assessment. So those of you who might be thinking, well, why not go back to 2014 and look at that data? The question was significantly different in 2014, and we really can't compare 2014 to the 2015 and beyond data. So unfortunately, we are stuck starting in 2015, but we do see an overall decline, a significant decline in males and a non-significant decline in females. Staying on the topic of prescription stimulant misuse, I do want to show you some data. This is from a recent publication in the Journal of Clinical Psychiatry that we did that looks at misuse by age. And so you see increases from 0.8 of a percentage point in 14-year-olds to a peak incidence, or a peak rate, prevalence of 9.3% in 21-year-olds. And I would emphasize that the 5 highest prevalence years, 19, 20, 21, 22, 23, not exactly in that order, are very common years for university attendance in the United States. Some 23-year-olds have already graduated, some 18-year-olds have started, but most college attendance does occur in that 19 to 23 year span, 19 to 22 certainly. And that's when you see the highest rates of stimulant misuse, and then they seem to decline to 24 to 25-year-olds. the nature of the publicly available data from the National Survey on Drug Use and Health don't allow us to separate out 24 and 25-year-olds, and then they combine 26 and 29-year-olds. There is restricted data that I am going to try and access to look at this continuing in 24, 25, 26, 27, up to 30-year-olds on a year-by-year basis, because I think it's very interesting if we do see really high rates during university attending years that decline. And the motives data really correspond with that, where you see that in 19 to 23-year-olds and even 24 and 25-year-olds endorse this, among those with any stimulant misuse, past year stimulant misuse. At the most recent episode, over 70% of individuals had what we describe as cognitive enhancement motives only. So those three are to study, to focus, or to concentrate. Any recreational motives, like to get high, to experiment, to counteract the effects of other drugs, are much less common in young adults. They start off more common in adolescence, in middle adolescence, but by late adolescence, they have declined to about 40% or less, and cognitive enhancement motives have taken over. The last thing I want to talk about very briefly are medication sources for young adults for opioid misuse. So what I want to talk about on this slide is the increasing rates of any substance use disorder. And to be clear, we're assessing this using United States criteria, which is from the DSM-4, which would be the ICD-9 criteria worldwide, and then opioid use disorder specifically. And you see that there isn't really a safe source. Sometimes I think we fall into this trap of thinking that a certain motive is lower risk or a certain source is lower risk, when the reality is any prescription drug misuse is associated with poor outcomes. But individuals who purchased their opioid, which was about 10 to 12%, or individuals who use multiple sources, more than one of the first four sources, had the worst outcomes versus those who obtained their opioid from a medical or physician source only, or those who got it for free from a peer or relative only. And so we're really interested again in looking longitudinally, prospectively, at how sources affect longer term trajectories. Well, with that, I want to, again, thank the organizers for inviting me. Thank the United States National Institute on Drug Abuse for the two grants. The first one was the one that looked primarily at young adults and adolescents. The second one, though, did include some data from older adults where we worked in some young adult analyses. And then I want to thank my primary collaborators on this research, Sean McCabe and Phil Velez at the University of Michigan, Jason Ford at the University of Central Florida, and Tim Willens at Harvard Medical School. The five of us have worked on a lot of this stuff, and they are great, especially Sean McCabe has been a great collaborator and mentor to me. And then the last thing I want to say is, please contact me, since I'm not here in person and I can't take questions, I'm not here live. Please feel free to email me with questions about today's presentation, about other research that I've done, or about any kind of collaborations. I'm always excited to talk to people about working on collaborations using worldwide data, different national comparisons. I think that's really missing from the literature and would be something that's very exciting. So thank you again for inviting me, and I hope you all have a great day.
All right, so we'll now close this session with a live presentation from João Matias, possibly the only name I'm pronouncing correctly. Apologies for the other speakers. João Matias is a scientific analyst at the European Monitoring Center for Drugs and Drug Addiction. João, the floor is yours.
Obrigado, Mafalda. Good morning, everybody. First of all, thanks for the invitation to present the work we do. I'll try to share my slides now. I hope you can see them. So thanks again for the invitation to present the work we do on misuse or non-medical use of medicines in Europe. And let's see what I can tell you or what I cannot tell you, because you will see it's a tricky topic for us. For the ones that do not know what we do or who we are, so we are an European agency working in the drugs fields. We are located in Lisbon for the last 20 years. We work with a network of focal points, so national entities that provide us yearly with data on drug issues. For the last 2 decades, we have been developing and improving tools to better understand what's happening in terms of drug use, drug-related consequences, drug supply in Europe. We have been working a lot with national experts to try to improve those tools. And our backbone system has always been 5 key epidemiological indicators on drug use, treatment, infectious diseases, mortality, coupled together with supply indicators, which we have been working on more recently. Of course, without forgetting also the monitoring of interventions like treatment responses, prevention, harm reduction. So all that is our monitoring framework. Last point on this, mandates, and this is key when I had to prepare this presentation, because it has been a bit of a challenge. And why is that? Our mandate only covers illicit drugs. So alcohol, tobacco, medicines are out. So what am I doing here? To present you on an overview of the European situation on the misuse of medicines. Fight Club, I don't know if you are into movies. Fight Club with Helena Bonham Carter, Edward Norton, Brad Pitt. I don't know when was launched, more than 10 years for sure. So it's a Fight Club, as the name says, and there are several rules, so that they cannot talk about Fight Club. Rule number 2, you do not talk about Fight Club. A bit like our work at EMCDDA. We cannot talk about medicines, we cannot talk about alcohol, and we cannot talk about tobacco. But once there, like the Fight Club, you need to fight. And once working in the drugs field, we need to talk about alcohol, tobacco, and medicines, even if in the context of polydrug use, it's unavoidable. We need to touch upon that, and you will see that we have done a bit of work, and also our tools, even if not targeting medicines, always touch upon that topic. There are a lot of specificities around non-medical use of medicines, the different motivations for use, the different substances, stimulants, benzos, opioids, the different sources of supply from friends, prescribed, not prescribed, the different research methods and tools we have at the moment, and how well they cover the different substances, and very important in this field, comparability. One of our main tasks as an European agency is to provide comparable information. And the field of medicines, I can tell you, it has been a huge challenge. If illicit drugs are a big challenge, the medicines and also alcohol, I have to say, are even a different level. When doing this and reflecting a bit, even if we are talking about data and methods, we always go back to the Zimberg drug set and setting, where the person, the motivations, the setting where the person is, it's key when we try to understand what's happening. So how do we do our work in terms of measuring and understanding the patterns of use for the different substances in Europe? And it's kind of you go to the supermarket and you have a huge variety of methods you can use. So the core components are what we call general population surveys, that are basically national household surveys, like the one the American colleague just presented before. These are national representative, where you can get the big figures on substance use. We have worked quite a lot with the member states on creating a comparable set of questions, and the same has been done for medicines use. Then we have another set of data tools like school surveys and also indirect methods to capture those that might be using drugs in a more problematic way. This implies having fancy statistical methods to produce estimates, and also targeted surveys that can be applied, for example, in nightlife settings or in music festivals. Then more recently, we have been working on what we call complementary methods that are methods that have recently been developed, not all, because drug checking services have been running for some decades, but that we are trying to work together with the different networks to get more information on the substances and the patterns of use. So drug checking services are one, but also hospital emergencies, wastewater analysis, web service, and also the analysis of used syringes. And I will show you briefly afterwards a bit of this. School surveys. SPAD survey, I don't know if you are aware, this is a survey that is carried out every 4 years in more than 30 countries in Europe. It covers more than 100,000 students aged 15 to 16. This is, I would say, the biggest data set and the most comparable one on, to give you a hint on prescribed and non-prescribed use of medicines in Europe amongst this specific group of the population. So the last SPAD survey was published, was from 2019, and you can see that on average there was around 7% of European students that have used in their lifetime inhalants, 9% pharmaceuticals, and NPS, which is also here, new psychoactive substances, around 3%. Inside NPS, sometimes in some countries there are also some benzos or fake benzos that have to be taken into account. So here's just a big table. You can find all this data in our website and you'll see all the details. Unfortunately, Belgium does not participate in SPAD or hasn't participated in the most recent editions. Here, just for you to see the prevalence of tranquilizers or sedatives use with the doctor's prescription. You see that the picture is quite different in Europe, with around 2% in Romania, Greece, to almost above 15% in Portugal. When we look at the levels of use without doctor's prescription, you see again some discrepancies between European countries, so really a quite wide variety of figures. Also, one of the things that is touched upon on SPAD is the data on alcohol taken together with pills in order to get high. And also here you can see that from 2% to 7% of students use alcohol or have used alcohol once in their lifetimes, at least once in their lifetimes, with pills in order to get high. If we look at trends, and this was a bit, I think, different than what we saw from the US before, looking at the 2 previous decades, we see that the lifetime use of tranquilizer sedatives without doctor's prescription has been quite stable, with girls using more than boys historically, and only with a very small increase from 2015 to 2019, but still at the same level as in the last 2 decades. When moving to adults, and I saw that actually Carolina, one Finnish colleague, is here attending also the webinar. 2 or 3 years ago, we were seeing what was available in adults general population service in Europe, and we saw that the information that was being collected on non-medical use of prescription drugs was very varied. And we really tried to create a module that could be applied by all the different member states. And so we came up with a set of core questions on different prevalence of use, frequency, but also then I'm not showing you, but there are also questions on the motives of use, motivations for use, sources of supply for the different types of substances, benzos, stimulants, and opioids. And so at the moment we are getting the first data for the countries that are applying this set of questions in their own national surveys. This is just a very brief example of a new Irish survey from 2019, where they have used their national survey to ask the questions we have developed, and we see that around 1% have declared non-medical use, mostly around young adults, so 15 to 34. And here on the adult population, a bit different than for the students one, males have a higher prevalence than compared with females. When looking at all use of medicines, we saw that for Ireland, non-medical use was quite low, but this is also might be linked also to the tool that was used, so a general population survey. And on that note, I also would like to say that we differ a bit with from what the US colleagues do. So we do not use a general population surveys in Europe to measure and to estimate the opioid use. So for example, we do not use general population surveys to present data on heroin use or any other opiates or opiates. So we differ a bit because we think this tool very powerful, but they do underestimate the use of such substances. Just another example of the data you can get from GPS, how they were obtained. So the source of supply, mostly from friends, or and the third by a prescription written for them, which I think mimics what was presented by Frederic and Julie before in their study. Another tool that we have been working more recently, it's a pilot study on several European cities, looking at the analysis of residues left in used syringes across Europe. And this doesn't tell you anything about those who use, but it can give you a hint of the substances that are actually being used. And for example, in Glasgow, you can see that benzos were used and different opioids that have been prescribed or not prescribed, methadone, buprenorphine, also in Helsinki. So this is just another example that you can have another method of research that can be used, in this case, to know which substances are being used in a population that probably is not reached by your traditional service, this being school service, targeted service in nightlife settings, or general population service done at home. Another tool that we have been working with is wastewater-based epidemiology. For the ones that are not so familiar with it, basically all that we eat, smoke, inject, snort, once inside our body, it's metabolized, the substance or the substances are metabolized, and once excreted, researchers can go to wastewater treatment plants, take some samples, and back calculate the substances that have been used. This can also be applied with medicines. And actually, it was a Belgian University, from Antwerp, that published very recently a paper describing the use of wastewater for medicines, and with 64, they have done the work mostly on opioids, with 64 different substances. Basically, what is key here is data triangulation after wastewater sampling is done. Why is this? Because we need records from medicine use that is prescribed in order to back calculate the proportion of use and substances found that are not prescribed. So that's why it's crucial to have good registries available and sources that you can compare with, because if not, you cannot distinguish what you are finding in wastewater. I remember 3-4 years ago in Lisbon, there was an interesting study on wastewater looking at methadone. So they were able to, it was not in the whole city, but in a 2 or 3 parts of the city, they had quite good access to the data on methadone prescription for that part of the town, and they were able to do the catchment area with one treatment plant, wastewater treatment plant, and they were able to compare the two sets. And at that moment in time, at least, the methadone residues found on wastewater was quite comparable with the data they had from prescribed methadone. So there were no signals of methadone being present in the black market, at least in that part of town and in that moment in time. Julie also touched upon this, the impact of COVID-19. I think it's unavoidable talking about this, and also in the context of medicines. We have launched last March, so March 2020, what we call a series of transport studies. We decided to look at, once we were all locked down, we decided to look at the impact of COVID-19 on people who use drugs, on the patterns of use, on drug services, and also on drug-related consequences, so deaths and emergencies. And after the first lockdown, and then in the also when we did a second round of this transporter study towards the end of last year, we saw a rise in benzodiazepine use, which we thought it might be an indicator of the pandemic's psychological impact. How did we do this? So we worked together with our networks from drug checking, wastewater, treatment data. So we tried to put all this data together. We had focus groups with, I would say, more than 200 European experts. We did expert surveys with our focal points, with our different networks. So we tried to put all of this together. We also did a mini web survey with 11,000 people who have answered on their patterns of use and how how COVID-19 was impacting on those. And so we put all of this together, and we produced 3 reports that you can find on our website, the last one being published last April. So, and common across the different sources, this rise in benzodiazepines use, which was something not new, because mostly from our early warning system, there were already some concerns about the increases in the misuse of prescription benzodiazepines, and also the emergence of fake or non-licensed benzos as NPS in some of the European member states. Also, we saw that we were getting reports that the use was going up, but in different groups of the population. So in one hand, we had those that were already using drugs in a more problematic way in a prison setting, but also then we saw reports of increased benzo use in recreational drug users, so those that use more infrequently. And this is something that we need to pay attention in the near future. Also from the harm reduction institutions that we work with together, we saw that there were also increases in more marginalized groups. Also, I remember, for example, from drug checking services, more fake benzos being submitted for testing. And also, for example, in Lisbon, in the mobile drug consumption room, in the beginning of the pandemic, increased injection of benzos when there was an initial shortage of crack cocaine and mostly heroin. But this shortage very quickly disappeared, and the past patterns of use were back, and so benzos were a bit left out of the picture again. Here, just another example that we saw an increase in the number of drug-related emergencies presentations in hospitals, a slight increase in the number of benzodiazepine mentions as a reason to go to an hospital emergency episode in 2020 as compared to 19. As I mentioned, got reports mostly from harm reduction NGOs working in the field that there were increases in benzo use amongst groups that before they were not seeing so. So for example, in Austria, our focal point reported the use of benzos in a very specific group, mostly linked to curiosity and experimentation during lockdowns. In Italy, benzos being very linked to a specific group of people linked to a particular genre of music, trappers. And also this wasn't a new trend, but it might be, as several things that we saw coming out of this transporter study, some of these drug-related events that were more visible during the pandemic were already there before COVID-19, but probably because of the circumstances we are living, confinement, being bored at home, escapism, trying to experiment new sensations, and also the feeling of being alone, isolation, probably all of this had an impact and made these phenomena a bit more visible, that they were already there, but probably now, as we're also probably talking about them a bit more, became more visible, and we need to pay attention in the future. And to finalize, we always talk about this, we have repeated this, and we need to. When we try to understand what's happening in terms of illicit drugs in Europe, measuring drug use specifically, and also on medicines, we need to have this helicopter view. I showed you just very briefly a range of methods and data sources that can be used to try to understand a bit more. And this is exactly what we are seeing here in this image with the elephant. If you touch a different part of the elephant, you will describe, and if you do not know it is an elephant, you will describe a different object. All of you will describe a different object. The same with the drugs field, we need to put together all the different methods. So that's why I was very interested to see that also your study that Julie and Frederic presented before, try to combine the online sources, the online survey. So it's key. If not, we will have only a side of the coin and we will not know what's happening. I'll be happy to take your comments or questions later on, and also you can contact me afterwards if you wish to leave any comment or if you have any question. So once again, thanks a lot for the invitation for us to present our work on this very complex field, and congratulations for the work you did on the study. And I'm sure that we'll have some hints also for us at European level to better improve our tools and on what we can improve what we are doing, and probably stop some of the things we do or do them differently. So Mafalda, thanks a lot.
Thank you, João. Thank you. That was great. We now actually open, I think, immediately the floor for questions and comments. So please go ahead and type in your questions in the chat section here. Or if you prefer, you can also use this raise your hand function above if you want to just jump in and ask your question orally to any of the speakers. Please indicate also if you're typing it in to whom you're directing your question so that we can just quickly liaise. I'll give you a couple of minutes. I'm also going to check the chat. So if you have any questions or comments, please feel free to share them with us now. We have about, I think, close to 10 minutes for questions. Okay, I see a hand raised, so please go ahead and yes. Good morning. Thank you for joining us.
Yes, I'm Karoliina Karjalainen from Finland. I work as a researcher in Finnish Institute for Health and Welfare. Thank you for this webinar, very interesting presentations. My question is for Frederic and Julie. I was curious what motivated you for this study. Is this an increasing problem in Belgium, especially among young adults? And for the context also, do you know the prevalence of non-medical use of prescription drugs in Belgium? What is the prevalence in the general population?
Thank you. Thank you for the question. Frederic or Julie, I don't know who wants to jump in. I think maybe we are having a technical issue here. It seems that Frederic's screen is frozen. My apologies for that. Let's see if they can come back in, or meanwhile, if Julie can just step in. I think Frederic is still stuck a minute ago, so please go ahead, Julie.
Yes, thank you for your question, Karoliina. The reason why we did this research, or why we proposed or wrote this proposal, was that it is actually a hidden population in Belgium. We indeed have some questions in the general population, but still we didn't have any views on their perceptions about non-medical use, and the questions are about different medications, but we did not have any in-depth view on the different types of medication. So that was the initial reason why we started this research. And we are also very happy that we now can present some of the findings that are missing in Belgium, and I think also in other countries for now. I'm not, maybe Frédéric, she's leaving. I'm not sure if I know the correct numbers of the prevalence in the general population, so I cannot be sure here, but it's not that high. And if we look at the target population, and particularly it is really the population of the young adults, which are which has the highest prevalence numbers, but also the older ones, of course. But that's another study that we need to conduct then. But it's not really a high number in general, in my opinion. But still, it was mostly based on the need for qualitative data, the need for some in-depth views, also to hear the voices of the participants of the target population itself, which is often not included in quantitative research. So that's the main reason why we set up this research. But I don't know if Frédéric wants to add something to this. You're back.
No, sorry, my internet connection was down, so I also was not sure about the question. Sorry.
Well, the reason was, the question was why we did this research in the first place, and if we had an idea of the numbers, the prevalence numbers in our general population survey. But I can't remember the exact numbers. Maybe you can. But,
no, because also like non-medical use, like the way we defined it in our study, is also without using prescription drugs without a prescription, or using it differently than prescribed, and then in the general population surveys, it's asked differently. For instance, they only focus on using without a prescription, or using for recreational purposes. So there are no really numbers at this time in Belgium. So I think this study also fills in this gap a bit, actually.
Yes, thank you. I'm looking forward to your final report.
Thank you, and thank you for the kind words. We have another question, I think, in the chat. I'm just going to read it. So when will the publication and results of the YOUTH-PUMED study be released? Are they already available? Thank you for the interest in the study. I can answer this one. We are working on it. So I think possibly at the end of the summer, the study report will be available, and we'll be sure to perhaps even share it via email with the attendees of the event, if there's an interest for that. And of course on our website, and I guess on BELSPO's website, that will also be made available. So very soon. We're wrapping it up, and that's also why we wanted to have this event, to still have some discussions around this, and if needed, some fine-tuning of some of the final chapters of the report. But the data has been collected and analyzed, has been presented here this morning, so we're really at the end stage of the project. All right. I don't know if there are any other questions. Do we still have just some words of thank you? And I think here there's another question. So thanks a lot for this excellent webinar and presentations. Thank you. I have a question for Julie and Frédéric. Your samples are highly educated. Do you have knowledge of other data sets with low education levels, or do you have hints as to what the prevalence rates and or motives for use are in this subset of the population? So that's one. And then also what, according to your sets apart your samples from the population of non-users. So either Frédéric or Julie, you can go ahead.
Yeah, so first of all, if you look at studies from, for instance, the US, but also what we see in our studies is, of course, that stimulant use is higher among higher educated people compared to people who are not in college or who are not studying. In Belgium, we can't. There are no data or surveys where we can look or where we compare low educated samples with higher educated samples because they're simply absent. What also I can only refer to research that was conducted abroad. What we also see is, for instance, that analgesics are more often used among people who are not in education compared to people who are in education. So I'm talking about the non-medical use. But in Belgium, we have no other data that where we can say something about lower educated versus higher educated samples. And as I said in my presentation, we only targeted those people who used prescription drugs non-medically. So it's not a randomized sample. So we cannot make statements about the general population or about young adults in general who use prescription drugs non-medically. I'm not sure if this answers your question or yes. Someone else can.
Yeah, and maybe I want to add that making a comparison with non-users, this requires another study, and would be interesting, of course, to see, for instance, the views of non-users about the non-medical use of prescription drugs. I think that would be very interesting to study. And in relation to the sample, indeed, we had only or mostly the highly educated, and I think this is also related to our recruitment strategies we have used or were we forced to use during our research because of the COVID. We were restricted a bit. In the beginning, we said, okay, it's 18 until 29. Without focusing especially on students, but during the research and using our recruitment strategies, it became clear that we were having a huge part of students in our sample, which were indeed then highly educated. So I think it also has to do with the recruitment strategies and the adaptations that we had to make because of COVID-19, I think. But it's a very interesting remark for sure. Thank you.
Thank you. We then have a follow-up question from Alexis on whether the recording of the webinar will be available online for replay. Yes, we will make these available on our website, and if there's a particular interest among some of you to share it with others, please let us know. We can also try to share the file directly via email or some other platform. All right, I'm conscious of the time, but if there's still one final question, we can still take it now. Otherwise, I suggest we go into a short break. I don't see any typing or raised hands. So I suggest we close this first part of the webinar here. Thank you for your questions and feedback and for attending so far. We'll resume the webinar at 11:25, so about 12 minutes from now. And then we'll have a more focused discussion on policy recommendations, and we hope to see you all again then. So thank you very much, and we'll see you in a couple of minutes. Thank you. Hello and welcome again. So thank you for joining us for the second part of today's webinar on non-medical use of prescription drugs among young adults. We'll now present some of the main policy recommendations emerging from our study in Belgium. And I'll immediately give the floor to our colleagues Kevin Ampli and Professor Christine Gillin. So please go ahead and take over. The floor is yours.
Thank you, Mafalda.
You're welcome, Kevin.
Oh.
Yes, we see the slides now, Kevin.
Okay, perfect. Hello, everyone. As Mafalda said, Christine and I are going to present to you a set of policy recommendations based on the study findings and a synthesis of information obtained in the literature review. In the first place, we are going to address recommendations for future research regarding general challenges in identifying and reaching young people who use prescription drugs non-medically. Our study recruitment process has proven that young adults who use or have used prescription drugs non-medically are a hard-to-reach population, in particular because of not having distinctive characteristics. They seem to lead conventional life and they are outside of law enforcement and treatment services. Despite applying diverse recruitment strategies over an extended period of time, our final sample of our study was still relatively small and clearly biased towards higher educated young adults, perhaps due to disseminating the survey through Facebook groups of study programs and student associations. Therefore, future research should devote particular attention to reaching different profiles of young users, particularly lower educated and working young adults. Another limitation of the current study is the wide focus on non-medical use of 3 types of psychoactive substances, which may have hidden particularities of use for each of them. Our sample may be particularly biased towards non-medical users of stimulants. Hence, future studies could focus in more detail on non-medical users of sedative or analgesics. In addition, the review of the literature and our study findings show that profiles, motives, and use patterns differ between the types of medicine used non-medically. Therefore, it is important that intervention and prevention programs are diversified and tailored to the specific target groups within youth using prescription drugs non-medically. Unfortunately, currently, no other studies have focused specifically on non-medical use of prescription drugs among young people in Belgium, so there is a crucial need for gathering more data about this heterogeneous population. Now we are going to focus on the policy recommendations. We have structured them around 6 thematic areas: society, education, household, healthcare, online communications, and recreational context of use. We are going to present each of them. The first policy area is society. In our study, we observed that the use of prescription drugs was considered by our research participants to involve a smaller risk than the use of illicit drugs. And this tended to be associated with the way they were produced, their medically sanctioned use, their legal status, and their widespread use by many people for health purposes. But it is important to inform young adults that if medical use of prescription drugs can be safe when taken as prescribed, however, this is no longer holds true when the prescription drugs are taken non-medically. This more nuanced understanding of substance use can help tackling the misperceived superior safety of medicines over other psychoactive substances. The societal image that is built about the use of medication, also known as the medicalization of our contemporary societies, may have negative consequences on the use of prescription medications and the perceptions of harms of their use. Therefore, it is important to increase awareness about alternatives for prescription drugs among the general population. For instance, sleep hygiene, exercise, or coping mechanism. As with alcohol, strict regulation of advertisement may be an important policy tool to protect young people against exposure to advertising medication and subsequent non-medical use of prescription medication. Existing legislation relating to medicines prohibits the public advertising of prescription drugs to the general public, but does allow it for non-prescribed medicines. So it will be of added value to improve the understanding of the potential implications of public advertising of over-the-counter medicines on the normalization of the use of medicines in daily life. Furthermore, our study findings show that people can become interested in the use of prescription drugs when hearing stories reporting that the medicines are commonly used non-medically by peers and when positive experiences are shared. In this context, the media can play a role in the prevention because reports with sensational headlines might spark interest and curiosity and foster experimentation. Therefore, a more careful and sensitive reporting might contribute to lowering that effect. The second policy area is education. It is a crucial component in the approach because first non-medical use of prescription drugs occurs at young age. In our study, the median age for using prescription drugs for the first time non-medically was 16 for analgesics and 18 for sedatives and stimulants. Therefore, school-based strategies could be designed to reach youth in different stages of their education, including middle school, high school, and college. Teachers are important role models, and they can be in an important position to prevent non-medical use of prescription drugs and reduce harms among young people. Our study findings has shown that non-medical use of prescription drugs among students tends to follow periods of peaks in academic workload, for instance, exam periods. So it is clear that universities and university colleges play an important role in informing their students about the risk of using prescription drugs non-medically. However, it does not appear to be common practice for them to discuss misuse, diversion, potential risk, and side effects of prescription drug use. While this may be difficult to enforce, it is critical that they address the use of psychoactive medication by including it in their alcohol and drug policy. Knowing that students are especially vulnerable to the academic and social pressure that can spur health risk behaviors, campus administrators, campus health professionals, for instance, psychologists or physicians, but also teachers, student support services, and resident advisors should be educated about health risk behaviors, and all of them should be involved in dispelling myths about non-medical use of stimulants to increase academic performance. Also, universities and university colleges must aim to change student misperceptions that prescription stimulants improve grades, as well as that a majority of students is engaged in non-medical use of stimulants or other prescription drugs. In this awareness campaign, it is important that students are exposed to actual rates of use or attitudes regarding misuse of prescription drugs. Also, in this setting, universities and university colleges should invest more in the organization of workshops, courses dedicated to study methods and stress management, and they should encourage use of available and accessible mental health resources to address anxiety or depression. In addition, the current crisis related to the COVID-19 pandemic might have increased those underlying mental health risks and therefore the need to address them. In this context, student support services play an important role in addressing the link between studying, coping with stress or anxiety, and the non-medical use of prescription drugs. Finally, it is also crucial Finally, it is also crucial for this issue to be addressed in certain health-related or pharmacology-related courses. Knowing that prevention information is most effective when the messages are co-created by students, one component of a larger effort to inform and educate students could be to set up community involvement projects in particular relevant courses. Thank you for your attention. For the next policy areas, I give the floor to my colleague, who is also one of the promoters of the research. Christine, the floor is yours.
Thank you, Kevin, and hi, everyone. So I will ending the presentation on policy recommendation, and another important area where research has been done is household. So everyone has a family pharmacy at home, which can be quite easily accessible to young people, and they could therefore take drugs which were not prescribed to them and without the knowledge of their parents. They might be curious about those medicines and experiment them for recreational purposes. So education efforts could focus on strategy to avoid diversion of medicine by improving safe storage and disposal of unused medicines, by setting up drug disposal programs and sensitization campaigns. Furthermore, and also based on our study findings, prescription medication, especially sedative and analgesic, were obtained through adult family members, parents in particular. So our respondents often contradict their knowledge of these medicines based on their advice, on parents' advice. It is therefore important that parents and other close family members are aware of the importance of their potential role in prevention, education, and harm reductions. And parents should communicate the risks of non-medical use of prescribed drugs to their children and should not have permissive attitudes. So we can recommend two things for this area. Firstly, increase awareness among parents about non-medical use of prescribed drugs and its risk. And secondly, inform and raise awareness about possible alternatives for the use of psychoactive medicines. About healthcare, as our research was on prescribed drugs, physicians are, of course, an important supply source of prescribed drugs used non-medically. First of all, prescribed drugs were obtained from a physician for medical purposes, but used outside of what the medical guidelines. Sedative and analgesic were mainly used for their potential therapeutic effects, but young adults did not adhere to a medical instruction. So regulation for prescribing and dispensing psychoactive medicine should be strict, while in the same time not undermining the accessibility to essential treatments for patients. And this is, of course, a difficult balance, and one possible measure to help prevent this common way of diversion would be to encourage physicians to prescribe medicine per unit or in a smaller amounts, as Tina van Averen mentioned this morning. And it's also important to stress the need to have alternative for medicine, like, for example, the possibility to direct the patient to a psychologist. And of course, pharmacists have also an important role in the early detection of dependence. So we should improve awareness among healthcare professionals of the potential non-medical use of prescribed drugs. Furthermore, most participants in our study obtain information about prescribed drugs from online sources or through social learning, but not often from a medical professional. They check the package insert, even if it's only for a few of them, but it can be difficult to read and to understand because of the medical terminology used. And the young also report that these medical professionals are not always easy to approach for questions about non-medical use and may be quite unsupportive. Nevertheless, physicians are still important, credible sources on information on prescribed drugs, and therefore they can play an important role in harm reduction. So using drugs non-medically could benefit from being able to discuss their use of these medicines with their physician in a non-threatening environment and with accessible language. So we must create opportunity for youth to talk about non-medical use of prescribed drugs with their physician in that context. And finally, for healthcare, will be important to complement this knowledge base with healthcare professional perception and own experiences with non-medical use of prescribed drugs in order to construct a more complete picture of this phenomenon. Therefore, we recommend additional research among this professional population. What about online communication? As we already told you, participants in our study look for information mostly online, in particular via search engines such as Google and through a specialized website of a professional organization of pharmacy. As you know, they are very active consumers on this kind of online content. Many respondents note that even if they recognize the value of a professional website as important objective sources of information, in their view, these sources offer overly generalized information with difficult wording, terminology, and not enough insights on what are the actual experiences by users. So they're especially looking for user experiences in order to inform themselves. And in particular, they indicate that peer-based online forum and social media contain useful information such as a trip report, personal story, experience-based advice from peers, and first of all, free of moral considerations. That's very important for you. The need to preserve anonymity is also reported as a fundamental condition for many young people when it comes to accessing information. And finally, in fora where non-medical use of prescribed drugs conversation take place, more other topics discussed seems to relate to illicit drug use. So that might be a problem because people who look information about non-medical use are mainly led to fora about illicit drug use. And this information about illicit drug use might increase curiosity among young people who have no experience with illicit drugs. So we should increase presence of different professionals in online platform, design and implement online harm reduction initiative, and improve access to anonymized channels of information. And last slide is about recreational context of use. So our study findings show that from the 3 types of medicine prescription, stimulants were mainly used for recreational purposes, and more often prescription drugs were used out of curiosity, experimentation, and young adults were able to use this medicine for those purposes because of having easy access. Some respondents also used medicines where no illicit drugs were available and consider prescription drugs a step lower than illicit drugs. Since our studies show that people who use prescription drugs for recreational purposes are more likely to have experience with illicit drug use, We recommend similar prevention and harm reduction efforts for the use of non-medical use as those already existing for illicit drugs. So we should really adapt and expand existing prevention and harm reduction efforts about illicit drugs to also consider prescription drugs. Thank you for your attention, and we are at your disposal to answer questions.
Thank you, Christine and Kevin. Indeed, we are looking forward to engage with you in the discussion of these policy recommendations and perhaps other ideas that these might raise among you. Before we do that, I turn now to Dr. Ellen van de Bogaerde, who will introduce the next moment in our program. So Ellen, please take it away.
Thank you, Mafalda. Good morning, everyone. I just wanted to thank everyone as a member of the research team at VIVES University College for joining us in this exploration of the non-medical use of prescription medicines in Belgium among young people. We wanted to take this opportunity because as a research team, we were really inspired a lot by all the young people that took the time to explain to us in plenty of detail the reasons for their use and the patterns of their use of these types of medicines. So we didn't want to organize this webinar without giving them the chance to voice their opinions in a more direct way as well. And we asked some of the 64 people that we interviewed for their comments on this research. So we edited a little video of 10 minutes that you will see next, where you will see these young people discuss the policy recommendations from in their own words. We organized the video along those dimensions that we identified previously. So first they will talk about society, then education, household, healthcare, online communication, and finally on the recreational contexts of use. We have left the videos in the original language, so we hope everyone kind of understands enough French and enough Dutch to understand these messages. There's also some in English. And we have obviously anonymized the respondents where they have asked to be videoed anonymously. So with this little introduction, I want to start. I think Frédéric will
raise your question. Hello, and thank you for joining us this morning.
Hello, my name is Nele van Tom. I work for the Federal Public Service, the drugs unit. I just have a question. I've noticed that in several recommendations, slide 7, slide 9, and also in the things that the people who were interviewed said that there's need about more awareness campaigns, information, etc. But I remember we're also the Secretariat of BELPEP, who is a platform on psychotropic experts. We have the Federal Medicines Agency has done also a survey on the use of methylphenidate by students for study purposes. And we had extensive discussions about it. And it's already mentioned as well that the more you communicate about it, the more people you reach who might be interested, who have never known about this possible solution and who might just start experimenting instead of being well informed on the downsides of it. So I'm just wondering, yesterday also it was in the news that you need to be very careful with campaigns because it makes people curious as well. And I noticed on slide 7 and slide 9 that it was mentioned campaigns. I was wondering how you feel about it, because there's also a risk about communicating too much about it. Thank you.
Thank you for your question. I don't know if Frédéric wants to take a first Yes, I see you turned on your camera, so please go ahead.
Yes, thank you for this question. We are indeed aware of the risk that people start experimenting with or start using it, as you mentioned, Ritalin, for instance, for study purposes. But I think it's really important the way you formulate it or the way you communicate about this. So also in our study, a lot of people or the young adults thought really that using these stimulants really were effective for student performance, and also what other research shows that a lot of these young people think that many students are using it for stimulant for study purposes. But those things, I think it's important to communicate, or in prevention messages, that you communicate, well, there is actually no evidence that using stimulants for performance enhancement is effective for study performance. And also that it's not the case that everyone is using those medicines for performance enhancement. So I do think that we can still that prevention is still essential, and we can still communicate these prevention messages about stimulant use, but we have to really emphasize that it doesn't improve your study performance, and there are also side effects, and there are also health risks associated to this. So I really don't think the solution would be just being quiet about this, because also students they hear stories from other students and they read certain things online. So I think it's essential that experts and health professionals really share these preventional messages, and also with regards to harm reduction. I'm not sure if this answers your question or.
Yes, thank you.
Okay.
Thank you, and thank you, Frederic. I see another, or is it still the same? Yes, it's still the same hand. I don't know if meanwhile others have questions or remarks that you want to bring to the forum. Please do so if that's the case. Okay, I don't see any other questions popping up immediately in the chat or any raised hands. And I'm also conscious of the time. So, of course, if you have other thoughts, or if you even think of concrete initiatives, I realize, or I'm aware that there's also attendees from other countries. So, for example, if you're aware of an initiative that could be linked to some of the aspects we mentioned in our presentation, especially with regards to policy recommendations, if you think of good practices or best practices that have been identified in other contexts, we would be very happy to hear more about those. So please feel free to contact us after this event, and we can also continue the discussion offline, of course. So with this said, I thank you all again for joining us this morning. And I think I've managed to make Aziz presenter. So Aziz, if you'd like to go ahead and say a few words, I can now, I think you should be able to take over.
Okay, thank you. Can you hear me?
Yes, we can hear you and see you.
Okay, I just wanted to say a few words. Sorry for joining in so late. There were other urgencies, but here I am, and I could follow very interesting presentations of people that do experience the topic of this research. And I think this is a real added value. This is the first time personally that I can see this kind of initiatives. It brings life to a topic. It brings life to recommendations that this team is carrying on further and discussing further with other stakeholders at national level. So I think we are in a project that deploys valorization on a very large scale, and this is something that we should praise, especially at BELSPO. And I think having an international webinar to discuss about this, to see how it happens live, is really an important moment. So I really want to thank you. I think it's quite late. This webinar should slowly come to an end. So Mafalda, I will give you the floor again.
Thank you, and thank you for the kind words as well, Aziz. Before we close, I'll just conclude by giving the word to Professor Tom de Kort for just some final thoughts. So Tom, please go ahead.
Thank you very much, Mafalda. Can everybody hear me? Yes.
We can, yes.
So good morning to all the participants in this webinar. I've been given the honor to formulate a few closing remarks, and I had prepared some notes to do so, but it was interesting to see how the little videos by the study participants actually went into the same direction of what I was going to say. I do think that this webinar and many participants and speakers in the webinar have underlined the importance of monitoring this phenomenon of recreational or non-medical use of psychoactive medication. So the importance of keep monitoring this fairly new phenomenon, or I will not state that this is a very new phenomenon, but it's now a little bit less under the radar with this study and other studies focusing on this phenomenon. So it surely makes clear the importance of monitoring, of triangulating different data sources, of making international comparisons, of findings from a study like this one with what has been done in other countries and in other continents. And it obviously also shows the importance of prevention. But I'd like to take the opportunity to put the findings and also the policy recommendations of this study and what has been presented in this webinar into a little bit a broader framework, because I do think that it's very important to frame the findings and the policy recommendations related to this study in what I would call broader societal trends, general trends in society, because we've seen youth perceptions on recreational or non-medical use. We've seen performance enhancement use of drugs. We've seen self-medication in these young people. We've seen also recreational use for fun. But there are clear links with very general sociological trends in society, I would say. For me personally, and you don't all have to agree, of course, but for me personally, they are a sign of the times in which we are living. It is a hard society which puts a lot of pressure on individuals to self-realize themselves. We as a society have come to put a lot more stress and a lot more importance on individual merits, individual performance, being successful, and it's a very hard rat race. And that also explains some of the more general trends of drug use in our society. As a society, we seem to produce more people who want to enhance their performance by using some drugs, but also want to self-medicate for different forms of unwell-being or ill-being, who want to look for all kinds of forms of relaxation and recreation by using substances. So I do think that we should not look at this phenomenon as a very isolated phenomenon, but frame it in very general trends in society and the role of drug use in our contemporary societies. Another remark, and it's also been underlined by one of the study participants in the video you just saw, is that we definitely, as a society, need to broaden our concept of drugs or our conceptualization of drugs, because in the heads of many people in the general population, among youngsters, but also among a lot of experts and health professionals, there is still some kind of a strange distinction between drugs, which we consider the illegal drug world, and then medicines. And as one of the participants just said in one of the videos, in the English language, in English native countries, they use the term drugs both for medicines and so as prescribed by health professionals, and for drugs used in another context. And that's a very common sense understanding, because within the medicalization of society, the pill popping culture, as it was mentioned before, our normalization of alcohol use, and alcohol remains one of the most dangerous and most toxic drugs that we know. The recreational use of medicines, so the use unauthorized by health professionals, but still used for functional reasons or for self-medication or for fun, it raises important questions about the root causes of these trends in society. So again, I want to make the link between what we saw in this study and what we see in the general population. And it was also mentioned by several participants in the study that it seems to them, and I do think that it's a common sense finding, it seems that society seems to encourage drug use, including recreational use or non-medical use of medicines, in many implicit and subtle ways. And that youngsters, as they testified in the videos as well, seem to have the experience that society does not look at the underlying causes of many problems and many factors encouraging drug use, but seem to promote the use of a pill or a powder or a substance as some kind of a solution. And so I'm very pleased to see that my fellow researchers made these videos with users and with youngsters, because these youngsters seem to have a common sense understanding of the concept of drugs, of the root causes of drug use, whether it's illegal drugs or whether it's the non-medical use of psychoactive medication. And therefore, it also underlines the importance, which was also presented today, of co-creation of strategies with youngsters and with users. It's, in my view, and I also want to make the link with the discussion in the media yesterday about prevention on drug use in schools. To me personally, it's not a matter of whether or not we should talk with youngsters and with adolescents and with younger generations about drug use. Of course, we need to talk with them. It might be a discussion of when you start talking about drugs with youngsters, and more importantly, how you talk with youngsters about drugs. And it might be that certain ways to communicate and to talk about drugs with youngsters actually makes them curious or encourages them to try those drugs. But there's other ways to go into a dialogue with youngsters. And I do think that the youngsters in the videos that we just saw underlined the importance of co-creation and involvement of their views and their perspectives. And I do think that my fellow colleagues made an important contribution here by mapping the perceptions of youth on drugs. So I hope that did contribute a little bit to the content of this webinar, but I'd like to end by not taking credits for this study myself, but thanking again the people that did the real work behind the scene to turn this study into a successful endeavor. Dr. Julie Tiberghien from VIVES and her colleague Dr. Ellen van der Boogaarde from VIVES University College, my colleague Professor Christine Guillen from the Université Saint-Louis, and Kevin Ampli as the researcher, and of course also Dr. Frédéric Bauin and my colleague Mafalda Pardal at University of Ghent. I'd like to thank them for all the work they did behind the scenes for this excellent webinar. And of course, I'd also like to take the opportunity to thank all the other participants who spent this whole morning on this webinar and thinking with us about how to interpret and how to take this further into the future. So thank you all for that.
Thank you, Tom, and thanks again to everyone that has joined us this morning and all the speakers today. We hope this was an interesting morning of discussions around this theme. And again, if there's any subsequent questions or comments, please feel free to get in touch with the research team. And we'll be making the report available in due time as well. So thank you very much for joining us this morning. Bye-bye.